Yeah. Dr. Grable brings his conversational style to bear with the COVID-19 vaccines. He is a board-certified internal medicine doctor. After 5 years' experience in a hospital-based practice, he opened the Complementary Care Center in Jacksonville, Florida. Enrollment to accept new patients is open, and Dr. Grable is available. Dr. Grable became fully trained in 5-element acupuncture. Although no longer practicing, which led to a 20-year exploration in what has been coined functional medicine. He has spent thousands of hours studying various aspects of holistic medicine, thousands of hours studying vaccines, and hundreds of hours studying these particular vaccines. Dr. Grable does not believe that alternative and conventional medicines are mutually exclusive. By keeping up with both conventional and alternative medicine, Dr. Grable can offer the best of both worlds. So let's hear it for a wonderful speaker tonight, Dr. Grable.
You just click forward, don't start. There you go. Yes, sir.
I got it.
Great, thank you very much. Well, I've been in practice 30 years. As Ashley said, I did 5 years of conventional and had a hospital practice through drugs and everything. And the last 25, I've been practicing what's called functional medicine. And doctors like me try to figure out what makes you tick and try to help get it fixed. I'm not opposed to using medicines, I just try to use natural things first. So most people, when I tell them this, they nod because it's kind of instinctual, but yet that's not really how medicine has evolved. And I don't know if anybody's had the experience these days of the doctor standing in the door with his iPad, or she with their iPad, and they listen just long enough to pull out the prescription pad, and then the visit's over. And that's not good medicine in my view. So anyway, I was asked, I gave a talk a few weeks ago at one of the local churches on COVID and vaccines and all this stuff, about a 3-hour seminar. And so tonight we're going to spend about an hour or so, or as long as you guys want. And I like to have kind of a conversational style. And so if you have questions, raise your hand, you're not interrupting, and let's just have a little fun with this. So, first thing I want to say is I do not dispute that vaccines reduce what's called a phenotypic expression of disease. And what that means is that when you give a vaccine, you can see a decrease in the symptoms of that disease. I do not dispute that. Disclaimer, this talk is purely informational. It's not intended to be medical advice. It's just a lot of it's my opinion as well. And talk to your healthcare provider, do your own research. I'm going to provide a lot of studies and stuff here tonight. So what are vaccines? Typically, they're small pieces of viruses or bacteria that stimulate the immune system to create antibodies to fight disease. This has been kind of the traditional view of vaccines. The difference with COVID vaccine is it's a whole different technology, which we're going to get into a little bit later. It's really a gene manipulative therapy rather than a vaccine for conventional sense. So there's two parts. This is important to understand, so I'm not going to get too deep into this because when you give these talks, you never really know your audience and where they are and what they're interested in. So I'm trying to keep it too technical, or we can go a little more scientific if you want. But we have two parts of the immune system. The first one is called the cell-mediated immunity, and the second is the antibody system. Now, when you are exposed to a bug, normally your cell-mediated immunity, or Th1, kicks in, and you trigger what are called T cells. And these are macrophages. These are like little Pac-Men. And they go up and they gobble up the virus or bacteria. Then they send signals to the antibody system to make antibodies. And that's how you can develop true lifelong immunity. And then your humoral immunity or antibody system, B lymphocytes produce antibodies, which you've heard the term antibody, right? It's also called the Th2 system. Well, vaccines typically bypass cell-mediated immunity, and they affect just this Th2 system. And one of the problems is that when you inject a vaccine protein, it can continue to stimulate the body to make antibodies over and over and over again. Whereas naturally, your body, when it makes its antibodies, it's gotten rid of the bad guy, everything calms down, and you have memory for when you might be exposed to that again. And this will be more clear as we go along. So weren't vaccines responsible for the elimination of most common infectious diseases? So isn't this what we're taught, right? If you asked most doctors what got rid of smallpox, what would they tell you? Vaccines, right? And we're also taught that vaccines are safe and effective. You hear that, safe and effective, safe and effective. Kind of like Sherry Tenpenny says, salt and pepper, safe and effective. So Suzanne Humphrey's an interesting gal. She is a nephrologist in Britain. And years ago, she started to make an association that she was seeing patients who had been recently vaccinated develop acute renal failure. Renal is kidney. She did not make any accusation. She did not make a cause-effect relationship. All she said was, it's really weird. It seems like I'm seeing a lot of acute renal failure in kids that have had vaccines. Well, not only did they come down on her, but they literally took her license. And this was a nephrologist. There's no such thing as a dumb nephrologist. They're all related. And so she was really fighting for her life. She finally got her license back in 2018. So she wrote this book, Dissolving Illusions. And you can get, before you can get it free online, that's like $10. You can get the ebook. And I'd encourage you to take a look at that. So what she did, she painstakingly went through and graphed out all of the infectious diseases. So when you say, what was it that got rid of all of your, or at least dramatically decreased your chronic infectious disease, smallpox, measles, etc.? It is sanitation and nutrition. So let's look at this. This is a slide, and this is 1841 here going to 1879. This is smallpox. You've all heard of smallpox, right? Well, you can see how it's kind of going along, kind of up and down. Here is where Massachusetts enacted a strict vaccine law in 1855. Now there was a dip, but look what happened. So if you can look at this graph, you see it really didn't make all that much difference, did it? In fact, here there's a big strike in smallpox. Well, get this, with smallpox vaccine, around the 1860, 1870 era, they made it mandatory. You know, we're always hearing about this possible COVID mandatory vaccination, and the naysayers say, oh, come on, that's ridiculous, we'll never have mandatory. Well, that's exactly what happened with smallpox. And people started noticing that the only people getting sick were those who got the vaccine. You know, it was around 1920 when they got that off the books. So that went on for decades. And if you don't think that can happen now, So here's whooping cough. This is where whooping cough was going just because of sanitation and nutrition. Here is where they introduced the vaccine. You can see that really made a big dent in whooping cough, can't you? Here's measles. See what measles looks like? You know, those ups and downs. There's where they introduced the vaccine. Yes?
Would you contribute that earlier part of herd immunity?
Yes. The question was, would I attribute this to herd immunity? Sure, absolutely. Because, you know, God made an incredible immune system in us. And we like to think we're so smart. And I liken us to kids in the garage playing with gasoline and matches. We know this much about the immune system. And it just frightens me to see how we just, and the virologists and all these, they're good people. I mean, they're trying to help humanity and they're trying to make a difference and all. I mean, I get that. But I think we need to be a heck of a lot more careful with what we're doing. So here's diphtheria. Here's where they introduced the diphtheria antitoxin. That really had a good impact on diphtheria, didn't it?
Wow.
Here, this one here, this is diphtheria and croup. Now look at this. This one's kind of interesting how diphtheria and croup are kind of naturally coming down the same way, aren't they? Yes, sir.
You may be going over, but what about something like polio? Because,
We're getting there.
okay.
Question was not, what about polio? Okay. So, again, it really didn't make, that's when they introduced the antitox, it really didn't make a difference in the curve. Now this here, this is just another slide showing, this is when the whooping cough vaccine became widespread in the 1940s. Again, this curve was just as, there's no change, there's no drop off in the curve. So this slide here, this takes several of the different diseases. You can see how they all basically were kind of having the same trend down. Here's when penicillin mass production, whooping cough vaccine, measles, diphtheria, they really didn't make that much difference. Again, here's another one, 1963. So they have to keep changing these vaccines. See, when they first came out with vaccines, they said, well, you're just going to get one vaccine and it's going to take care of disease and everything's going to be great. And they keep moving the goalposts. It's kind of like Dr. Anthony Fauci keeps moving the goalposts. So this slide, scurvy, who knows what scurvy is?
Vitamin C deficiency.
Very good, vitamin C deficiency. So you can see how just through knowledge and nutrition and so forth, scurvy was going down. That curve kind of looks pretty similar, doesn't it? Look what happens when they superimpose scurvy over pertussis rate. Look at that. Of course, there's no correlation there. That's just incredible. Here's scurvy and measles. Now this slide, this is vaccinations, and they were actually starting to trend off. And as the vaccinations are going down, so is the incidence of smallpox. Are you understanding that? Okay, so here's a slide. This got a little busy, but one of the things that's kind of interesting, it's hard to see in this slide, but in the smallpox, there was a spike in smallpox here after the vaccine came around. Okay, so I thought I had a slide of polio, but anyway, let me answer your question about polio. So same thing with polio. One of the things about polio is we now think that probably half the polio cases were actually Guillain-Barré syndrome and not even polio. Now I do believe polio was a true virus and there were some unfortunate people that had severe problems. But there were millions and millions of people that had polio that got over it just fine. And their Klenner, who was one of the big MDs that worked with vitamin C, cleared 60 out of 60 polio patients with IV vitamin C. Isn't that interesting? So, okay, but if everyone says vaccines are great, why not we just try them if they don't pose a threat? You know, what do we have to lose? So what we're going to do is look at a few of the vaccine properties and constituents. And this comes from a book by Richard Moskowitz. And it's a tome on vaccines. This is the guy you hire if you want to go to vaccine court. And the book is loaded with references. It is detailed. It's, for the obsessive compulsive, it would be their dream. I actually took Humphreys and Moskowitz's book and condensed it to 100 pages of notes. And anyone that wants those, I'll give you my email. Just send me an email and I'll send them to you. That'll save you a lot of time. These books are about that big, the two of them. So one of the things you see, vaccine ingredients are aluminum. And there was a 1922 JAMA article that argued even a small amount of aluminum food is toxic. When exposed to stomach acid, it's carried throughout the body. Tom Lendovic demonstrated that the central nervous system bears the brunt of aluminum toxicity regardless of its source. Other studies have linked aluminum with a whole range of neurodegenerative disorders. So there was a lot of talk in the recent past about aluminum and dementia, and like Alzheimer's and that kind of thing. They supposedly discredited that, but I don't think that's been discredited. I think that is definitely tied in as, for your Parkinson's, your Alzheimer's. I think heavy metals play a big part in that. So one of the problems with aluminum is there's a long retention of aluminum. it can stay in your system for years. What the body does when you're exposed to various toxins, the body sticks it in the bone and in the fat to get it out of circulation. There's a tight association with what's called the vaccine antigen. That's just sort of like little things that the antibody attaches to. There's a tight association with that in tissues. Animals fed a Western diet produce Alzheimer-like symptoms. And one of the problems is when you inject aluminum, it's different than taking it orally because it gets into the body worse, more effectively. Okay, so look at this, is an interesting slide here. So aluminum is found in hepatitis B vaccine, diphtheria, DTP, H flu, pneumococcal, hepatitis A, HPV, and meningococcal V vaccines. So this is data from the Agency of Toxin, Substance, and Disease Registry. Safe aluminum doses range from about 3 micrograms per day for a newborn up to about 9 per day for a 1-year-old. One dose of Prevnar 13, Pedvax, Energex, and Infotrex, which is not uncommon at all to give several vaccines at once, delivers 1,225 micrograms of aluminum. That ought to make you go, huh? So if they're saying that up to 10 micrograms is safe, and they're giving over 1,200 in one dose, of course that has nothing to do with it. So another preservative they use is mercury. The CDC has officially come out and said vaccine ingredients do not cause autism. Since 2003, 9 CDC-funded studies have found no link between thimerosal, which is mercury, MMR, and ASD in children autism. So here's an interesting fellow. You guys have all seen RFK Jr., you know who he is? He's the nephew of John Kennedy, and the raspy voice. I have to go back and look at his story, but he's become probably one of the top vaccine experts in the country.